Hello, my name is Dr. Virginia von Schaefer. I thought it would be important to talk about the COVID virus, its prevention and treatment, and basically how it works, because this is such a very important issue for us to face as a society as a whole right now. Viruses, as we know, are transmitted with aerosolized droplets from the respiratory system. And COVID virus isn't any different than Epstein-Barr virus. There are many viruses that are transmitted in this way. So the problem becomes that when the virus is taken into the mucosa of your respiratory system, your nose and your mouth, and it goes into your lungs, it goes to work to try and enter and recruit the replicative machinery of a normal cell to make viral particles. Now, in order for the COVID virus to do that, it has some essential features that allow it to enter. The most talked about and studied is the spike protein. And the spike protein is kind of like a burrowing agent that attaches to the cell membrane of the target or the host. And once that attachment occurs, the protein kind of divides in two, and it has two different functions. And one of them attaches to a certain receptor on the surface of the cell that's related to the angiotensin converting enzyme 2 that maybe you hear about in the news, maybe you don't. But it's a receptor that has to attach to. And then the second subunit allows for fusion of the viral entity with the membrane of the cell, the host cell, so it can enter. Once it enters, there are other proteins that are related to the development of attaching the DNA and inside the cell to leash this whole machinery to replicate the viral proteins and make more viruses. So basically, that's what it does. There is an envelope protein which protects it as well, but the most of the focus in research, especially in development of vaccines, has been to identify and sequence the messenger RNA for the spike protein and make a vaccination against that. So the problem we have with infection of COVID-19 is that if one is infected and becomes symptomatic, the course can be very rapid, and the immune system does not have time to develop the machinery that will help it identify and kill the particles. That's what they call the adaptive or humoral aspect of the immunity. So we make antibodies that will coat these abnormal entities, and then we make cytotoxic T cells that can go in there and kill them. So we don't have time because of the rapid progression of a viral infection if a person is sick. So the focus has been on obviously trying to treat acute infections and then also to prevent them. So we come to the option of creating a vaccine that can prime our immune system to identify these abnormal proteins that are essential for the COVID virus to replicate, and hopefully leash our immune system to identify them and to kill these entities before it becomes a problem. This section, we're going to be talking about the development of vaccines against the COVID virus. Now, I'm sure you've heard in the news and read about the Pfizer BioNTech vaccine and the Moderna vaccine that is just now being released and approved by the FDA. This vaccine has messenger RNA for the spike protein of the COVID-19 virus. And it's encased in a lipid I think it's polyethylene glycol, and it's introduced into the person so that the immune system can get an idea of the picture of this spike protein and create antibodies and activate cytotoxic T cells against this protein if and when the individual is again exposed to COVID virus. This is essentially what we do in a vaccination. And of course, there are many different techniques. The two vaccines I just mentioned employ this particular technique. It's not a live cell, and it's not made with your own material. However, it is designed to stimulate your immune system and activate your immune system against this protein. As we discussed previously, the spike protein for the virus is very, very important. It can't get to first base unless it's got a spike protein. The spike protein is like a little probe that goes inside the cell membrane, burrows into it, attaches, and then transforms itself into two subunits, and the function is basically to allow the virus to fuse with the membrane, the cell membrane of a normal host cell, and allow the particle to get inside the cell and then take over the replication machinery to make more viral particles using the host equipment. Now, the vaccine is supposed to activate the immune system. And of course, there are a number of proteins involved, and the RGCC company, the immunology lab in Greece, has created a COVID-19 vaccine. And this is what I would like to talk to you about in detail. I think everyone has to do their own research. You have to be informed. You have to decide what's best for me, but I'd like to present this material to you. The RGCC company has been making dendritic cell vaccines, live cell vaccines, from patients' own blood and their own dendritic cells for many years. They took this technique and applied it to immunizing people against their own cancer cells, circulating tumor cells and stem cells, for long-term protection against development or redevelopment of the cancer. They also developed a very effective way of evaluating whether or not a person's immune system is ready to receive the vaccine and utilize it. And they also developed testing to show and assess if the vaccine has done its job, in other words, activate the immune system. So, as you recall when we discussed this previously, if you have an infection, the acute reaction is a fever, and it's monitored by some cells called the macrophages. The longer-term protection in the immune system is monitored by the dendritic cells. And the dendritic cells are a type of monocyte, and they are designed to survey the organism and the borders. So if they find and see an entity that's foreign and unwanted, they'll kind of take a picture of that and then go into the immune system, leave their post, and then educate the B cells and the T cells of this picture, so that the B cells can secrete antibodies and the T cells can turn into cytotoxic T cells and kill any entity that possesses that marker. So in the case of the COVID virus, we have not just one important protein, the spike, but 4. And so RGCC has created a sequence of inoculation with dendritic cells, your own dendritic cells, that are programmed to identify all 4 of those proteins. And so the sequence of injection is actually 3 injections over a period of time, not just 1 or 2. And the theory being you want to be immunized not only against the spike protein, but the nuclear proteins and all the other ones too, in case the envelope, in case you get past the first line of defense. We know that viruses can live inside cells, and this particular added protection is very important for that component. So in summary, the RGCC vaccine is intended to activate your own immune system and to develop an immunity based on both the antibody production, which is the humoral portion of it, and the cytotoxic T cells, which is the cellular defense. And then eventually to produce what we call memory cells that remember the picture of all those proteins, so that in case you're exposed to the virus after the immunization, your immune system is already ready to identify and activate all the aspects of the immune system to kill the virus before it becomes a terrible infection. It's a very, very important point to also bring up is that this vaccine, not only the technique, which has been used for many, many years and perfected by this lab, they have used this vaccine for over a year and have an 86% success rate in terms of full immunization at a year period of time. Because the testing is also informative about the level of antibodies that one has developed. If after a year a person's level is not quite adequate, a booster test or booster immunization can be given. So in this portion, I want to share with you some information about the IST-12, which is the RGCC Immunology Lab in Greece, their designation for their COVID-19 vaccine. So we've talked about how the virus works, and we've talked a little bit about the way the vaccines work. But what can you expect if you're going to get the vaccine? We know from some of the currently released ones, the Pfizer and the Moderna, people can have mild flu-like reactions or headaches. Some people have anaphylactic shock. It's really not clear. But we want to remember it's because there is foreign material in those vaccines. The lipids that are used to encase the messenger RNA may cause a significant reaction. So in the case of the IST-12, the vaccine is made from your own cells. So there's nothing else in the preparation but your own cells. Your dendritic cells have been marked to identify and activate different aspects of your immune system response in accordance with the marking of the dendritic cells with the protein to identify the 4 different major proteins that the COVID-19 virus needs to replicate. So when you give your blood specimen, obviously the lab has to have your blood and your cells to work on. We send the specimen to Greece, and they separate out the dendritic cells, and then they create 3 different live cell preparations that will be administered to you in 3 different sessions, approximately at day 1, day 8, and day 16 or 17. So each one of the injections is intended to activate a different aspect of the immune system against these 4 entities. The side effects have been noted to be mild flu-like syndrome or headache, really not too much of anything. No one has had any severe reactions, no life-threatening, no deaths post-administration. So just to remember, because it's your own cells, you're not getting a foreign material or a synthetic material, you're getting your own cells back. It's just that they're primed to identify the COVID-19 virus. Now, day 38, after the first injection, you will have to send another specimen of blood to check the IgG and IgM, the immunoglobulin levels, against the virus. And at day 76, there's also another test that has to be sent, and also at day 180. So the testing is pretty much routine. they've been doing this for quite a long time. So with the results of the test, we can interpret if the vaccine against the virus has effectively been incorporated into the immune system. Because eventually we want not only the B cells that make the antibodies and the T cells that can be cytotoxic for these unwanted entities, but we also want memory cells to show up as an increased population so that we know that the markers that we've immunized you for are now in the memories bank of your immune system and are ready to be recalled if you are ever exposed to the COVID-19 virus again. It's important to know that certain people are not good candidates for the vaccine. Patients that have multiple autoimmune disorders, the vaccine may or may not take. A pregnant woman clearly is not a candidate for a vaccine. Anyone who's had a whole blood transfusion within 120 days should not draw for the vaccine. You have to wait till your own cells are more in dominance. Anyone who's had cytotoxic therapy, such as a cancer patient, within the last 30 days, really is not a good candidate. We actually recommend being off of chemotherapy or cytotoxic therapy for at least 2 months. Then anyone who has an active infection with SARS-CoV-19 is not a candidate. However, once they become asymptomatic, and they can receive the vaccine successfully. Overall, it's a very safe treatment and one to consider seriously if you want to have a lifelong vaccination against this virus. Thank you.